Young people during COVID-19 lockdown faced a lot of challenges in accessing medical care. And you find out that these young people reached out to me and were telling me, Gloria, how can we access ARVs? And it was really a big challenge because they could not go to health centers because they could not, the transport was locked. So this was a very big challenge because we could not access our medication and we could not access our ARVs. And also another challenge, we had mental health challenges as young people living with HIV during this pandemic. And this has also affected us in a way that some people, of course, when they have mental challenges, they cannot be able to take their drugs very well. And I talked about economic empowerment earlier on. Some people during lockdown, they lost their jobs, and I can say that I'm also part of it.
The United States government, through the President's Emergency Plan for AIDS Relief, or PEPFAR, has responded to these challenges by expanding client-centered interventions through village health teams, expert clients, peer networks, mentor mothers, and others. By scaling up social network strategies among adolescents and young adults, the identification of HIV-positive cases and their subsequent treatment initiation has increased.
There have been complaints that COVID-19 pandemic has negatively affected our fight against HIV and AIDS. There were reports of people living with HIV having challenges like accessing food during COVID-19 lockdown period, which then affected their adherence to the antiretroviral therapy. We know that disruption is taking HIV medicines. It affects viral suppression, which may lead to increased HIV infections and ultimately death. On a positive note, as a result of the temporary lockdown and disruptions in the public transport, many community-level structures for HIV services, such as community-based drug distribution mechanisms, proved very helpful. This, therefore, has shown that we need to make targeted investments into and strengthen community systems.